These are 12 silent symptoms of a heart attack, according to cardiologists. When you think of a heart attack, you probably picture an intense, chest-crushing pain, maybe even accompanied by cold sweats and overwhelming weakness. But here's the thing, not all heart attacks scream for attention. Believe it or not, up to 20% of heart attacks are what experts call silent. According to the Centers for Disease Control and Prevention, CDC, these silent heart attacks happen without the classic, dramatic symptoms you'd expect. The damage is still done, but the person might not even realize it. This makes it incredibly important to be able to spot the more subtle, easy-to-miss signs of a heart attack. The sooner you recognize them and get help, the better your chances of avoiding permanent heart damage. To help you stay ahead of the game, we've gathered insights from top cardiologists and heart health experts. Here are the 12 sneaky signs of a heart attack that you should never ignore. Ever have one of those days where something just feels off? Maybe you can't quite put your finger on it, but deep down, you know something isn't right. According to Dr. Stacy E. Rosen, a seasoned cardiologist, many heart attack patients report a vague but persistent feeling of impending doom. If your instincts are telling you something is wrong, don't hesitate, listen to that inner voice, and call your doctor. Some patients also mention feeling mentally foggy or less sharp right before a heart attack. Chest pain is often described as sharp or stabbing, but sometimes it feels more like intense pressure, as if someone is squeezing you tightly. Dr. Jim Liu, a cardiologist, notes that this squeezing sensation could be your heart's way of signaling distress. Fatigue is one of the most common and often overlooked signs of a heart attack, especially in women. Dr. Rosen points out that people who are on the verge of a heart attack frequently feel unusually tired and struggle to do their everyday activities. This exhaustion happens because your heart isn't getting enough blood flow, which puts extra stress on your body. If you're feeling unusually fatigued, it's worth discussing with your doctor. They might recommend an EKG or other tests to check your heart's health. If you notice a dull ache or soreness in your back, chest, or arms, don't brush it off, especially if it's something new or doesn't go away. Dr. Rosen explains that these subtle pains could be signs of a silent heart attack, even if they don't come with the typical chest heaviness. Another sign that often flies under the radar is pain that only shows up during exercise. Dr. Liu explains that if you have a partial blockage in your coronary arteries, your heart might not get enough blood flow during physical activity, leading to pain or weakness. If you suddenly find yourself out of breath after climbing a flight of stairs or carrying groceries, when that used to be no problem, it could be a red flag. Dr. Rosen says this is especially common in women and could indicate that your heart isn't getting the oxygen it needs. Waking up in the middle of the night, gasping for air, or feeling short of breath right after waking up could also be a warning sign, according to Dr. Annapurna Kini, a cardiologist. Your heart might be struggling to pump oxygenated blood to your body, causing these breathing issues. Occasional heartburn isn't usually something to worry about, but if you're experiencing it more frequently or it feels different than usual, it could be angina, chest pain caused by reduced blood flow to the heart. Sometimes, heart attack symptoms can mimic digestive issues like nausea, vomiting, or general stomach discomfort. Dr. Rosen warns that this is especially common in women. If you're feeling queasy for no obvious reason, it's worth checking in with your doctor. Unexplained tightness or discomfort in your throat, neck, or jaw could also be a sign of a heart attack. Dr. Kini stresses the importance of paying attention to these subtle changes, particularly for people with diabetes, who might not experience the more typical heart attack symptoms. If you're breaking out in a cold sweat for no clear reason, don't dismiss it as just hormones or aging. Dr. Liu explains that unexplained sweating could be your body's way of signaling a heart attack, especially if it comes on suddenly or during rest. Feeling dizzy, lightheaded, or faint could also be an indicator of a heart attack, says Dr. Freeman. Women, in particular, are more likely to report these symptoms, so it's important to take them seriously.